Hello everyone, this is Dr. Asma Zafar and I'm back with an exciting new topic of dentistry. So today's topic is more of a review on xerostomia, which is quite popular in dentistry. Now what is xerostomia? Xerostomia is a sensation of oral dryness which could result from decreased salivary flow in the oral cavity. Now the patient might come to you with a complaint of oral dryness, burning sensation in the oral cavity. They could have problem with the swallowing of food, or they could have lack of taste or decrease in the taste. Now the question is, how is it caused? Now it could be caused as a result of autoimmune disorders, radiation treatment in case of head and neck cancers. The use of certain medication can also cause xerostomia. Those medication could include the use of antihypertensive drugs, anticholinergic, antidepressants, sedatives, and analgesics. Another study showed that 100% of the patients who had radiation treatment for head and neck cancers or were diagnosed with Sjogren's syndrome complained of xerostomia. Let's discuss how can you diagnose xerostomia in a patient. When the patient comes to the clinic, you will notice fissured tongue or lips, filiform papilla atrophy, erythematous or parched oral mucosa. The finger may adhere to the oral mucosa during palpation, and evident lack of saliva on the floor of the mouth. There are certain techniques which could be employed to test the hyposalivation in a patient. Those include psilometry, psilography, or biopsy. Psilometry is the process of measuring stimulated and unstimulated salivary flow, while psilography is the 3D imaging to visualize salivary glands or any problems that the salivary glands might have. And then comes the biopsy, which could be done in cases of sarcoidosis, amyloidosis, or when a salivary mass is suspected. Now let's talk about the treatment or management of such patients when they come to you in the clinic. In order to manage such conditions, palliative or symptomatic treatment could be used in addition to the pharmacological interventions. Initially, the instructions that should be given to the patient include frequent sipping of water, chewing sugar-free gum, sucking on sugar-free candy, avoiding caffeine, tobacco, alcohol, or dry or hard to chew foods, correcting dehydration by increasing fluid intake, regular oral hygiene and dental care. Use of saliva substitutes or artificial saliva could also be used. Now comes the pharmacological intervention. The pharmacological treatment includes the use of silogogue drugs. Silogogue is a term which is used to define any drugs which could help to produce saliva. Some very commonly used silogogue drugs include cevimeline or pilocarpine. Another intervention that has been used in the past is electrical stimulation of salivary flow, which uses intraoral devices to increase the flow of saliva in the oral cavity, but it is not a very effective method or a very practical method for everyday use. The patients undergoing radiation of head and neck area may benefit from the use of amifostine. Amifostine is a drug which could help to protect the tissues from the damage that could be caused as a result of chemotherapy or radiation therapy. The prognosis of xerostomia highly depends on the underlying cause of xerostomia. The interprofessional team could include the use of dentists, pharmacists, physicians, specialists, the use of specially trained nurses, and they all need to collaborate with each other to achieve the best results for the patients. Now that was it for today. See you another time. Thank you so much.